Hi, I'm Dr. Babar Ahmed. Welcome to Health Matters KC, where we discuss a healthier, stronger, and more mindful you. Imagine hearing the words, "You have cancer." For most people, that moment is a full stop in life. But what comes after? The fear, the isolation, the anxiety, those are the chapters we don't often talk about. In today's episode of Health Matters KC, we're diving into the emotional side of cancer care, what patients go through mentally and emotionally, and how we can support them. I had the chance to sit down with Dr. Kadie Harry, an experienced oncology psychologist who has spent years walking alongside patients and families at some of their most difficult moments in their lives. Whether you're a healthcare professional, a caregiver, a survivor, or just someone trying to understand how to show up for others, this episode is packed with insights on resilience, support, hope, and resources. Well, hello everyone. I'm really glad to be here today and introducing an oncology psychologist, Dr. Kadie Harry from St. Luke's Medical Center, and also from the Kunst Advanced Breast Cancer Institute. And Dr. Kadie Harry, I'm so glad that you're here and you made some time out for us.
Of course, thank you for having me.
Yeah, but I'm just going to dive into this, and I hope you're ready. So these are some questions are from myself, some are from people. They wanted me to ask these questions so we can just try to get the most information out there. So as a oncology psychologist, what are some of the most common psychological challenges that you see faced by cancer patients?
So the cancer experience can be a life-altering experience for individuals. So oftentimes it comes with fear, worry, depression, sometimes even grief, not just about having cancer, but the loss of normalcy, how it might impact their identity or even relationships with others.
So in your field, how would you describe what an oncology psychologist is? How is your role different from that as a regular psychologist? And how can they help?
So most oncology psychologists have specialized training in how we specifically treat the most common concerns of cancer. Oftentimes we are fellowship trained, so we've had an experience working with lots of patients across the cancer trajectory. And then optimally, we work as part of the medical team. So we're working, collaborating with the medical oncologists, the nurses, palliative care providers, so that patients feel like they're getting whole person care.
And in your field, and because of cancer being as such a horrific disease and diagnosis, how common is it for patients to experience depression and anxiety, and as well as their families?
So reporting some level of distress is pretty high, about 40%. When we break that into those who actually meet criteria for depression, that varies widely, dependent on cancer type and stage, but most research estimates are between 8 and 24% for depression. For anxiety, it's a bit higher, about 20 to 30%. And then some of that's even higher when we're looking at specific anxieties, like fear of cancer recurrence, or the fear that the cancer will return or progress, or even scan anxiety. So that's anxiety close to a time of a scan or certain types of tests.
Okay, very good. And when it comes to signs and symptoms to look out for, for caregivers when they're experiencing this with their loved one, that they are diagnosed with cancer, what would be something that you would, what's something that they should seek help for, or when they can see that their loved one is struggling emotionally?
Yeah. So for cancer patients, some level of worry, a little bit of changes in mood because they may not be feeling well during treatment is normal. A good gauge to seek further help are things like, is it starting to impact your sleep or your ability to concentrate or connect with your loved ones? Is it harder for them to get out of bed, or they're less interested in things? These are signs that it might be worthwhile to seek help, whether that be connecting with community resources, support groups, or even seeking professional counseling.
Okay, excellent. And then those family members, how can they best support a loved one with cancer emotionally?
So a really good place to start is to ask, how can I help? That way you don't have to guess. We see a lot with individuals that loved ones want to be helpful, and so they just start doing things. Sometimes that's helpful, sometimes they pick things that maybe aren't the best. The other thing is to offer specific ways that you can support them. Because sometimes from the cancer patient perspective, they're thinking, I don't really know what I need. So when their loved ones are saying, hey, I can make a meal or I can take you to treatment, some of those specific things are really helpful.
And then what would be the best way for a patient to get help? Let's say they just got diagnosed and they're like, okay, where do I go from here? What's the first thing you think that they should be doing?
So I think it's really helpful to ask their medical team, do they have a psychologist on staff? So that's a great place to start. Looking into local community resources. Gildas Club Kansas City is a great example. This is a nonprofit organization in Kansas City that offers completely free classes, education classes, and support groups to anyone affected by cancer. So not just for patients, their loved ones, they have kids programs. So another way that they can support the patient and everyone around them.
Oh, that's awesome. That's so good. And then when it comes to the different stages of cancer, obviously there's the first diagnosis phase, then there's a treatment phase, and then obviously there's going to be towards the end phase when it's the last stages. Then how do you support people during those different stages, from diagnosis to survivorship to the end of life care?
So sometimes in the beginning there is a lot of shock and fear. There's a lot of waiting when you get a cancer diagnosis, needing all of the tests and a treatment plan. So oftentimes we're working on strategies specific to managing those anxieties about uncertainty. When people are moving through treatment or into survivorship, then oftentimes it's more about managing how any of the side effects might impacting their quality of life or fatigue. And then at end of life, it's really about using strategies that help with acceptance, but also with present moment awareness and really living life in a way, even with cancer, that's still very meaningful to them.
Basically focusing more on quality of life. Right?
Yeah.
So can psychological care improve the treatment outcomes for cancer patients? Like, have you seen that in your practice? Like patients who seek psychological care versus ones who don't?
Absolutely. So not only in my practice, but the body of literature is very clear on this, that those who are taking care of their mental health are going to have an improvement in their health outcomes as well, specific to cancer too.
And what advice would you have for caregivers who are experiencing emotional burnout or just fatigue from taking care of their loved one with cancer?
I think the biggest thing is to make sure that they're also taking care of themselves.
Okay, yeah.
It's really easy for loved ones to focus all of their energy and attention on the individual going through cancer. But it's really hard to show up and be a good support system if you're not also making time for your own self-care.
Yeah, you have to take care of yourself before you can take care of the other person too, right?
Absolutely.
Kind of like when you have to put your own seatbelt on first before you put the seatbelt on for your passenger.
Yeah, same thing. Yeah, in an airplane too, right? You have to put your own oxygen mask on first.
Exactly. And I'm sure it's very unfortunate, but I'm sure you see a lot of children and teenagers who have this devastating disease. So how do you help the children or their teens cope when a parent or sibling is diagnosed with cancer, or vice versa?
So in my own practice, I focus primarily on adults, but I do talk a lot with our patients on how they talk about cancer with children and teenagers, how they check in with how they're doing. Most of the recommendations are really to be open and honest with kids and teens. Sometimes as a parent, our protective instinct says, maybe I should withhold information. That ends up being scarier because all humans, doesn't matter how old you are, our brains like to fill in the blanks. So sometimes when we're filling in the blanks, it's for something that's scarier than if we shared information. And then the other key piece is just to make sure that information is developmentally appropriate and matches your kids' or teens' needs. And then the other really good advice is to continue to check in and make room for lots of their questions.
Sure. Yeah, because I'm guessing depending on the age, it's not about necessarily the information that's being explain to them, but how you explain it to them versus if you have a 10-year-old versus an 18-year-old.
Absolutely. The language, the words that you use, how much you share. And I always tell people that they know their kids better than anybody else.
Yeah.
So they can also use their own parental intuition to say, okay, I think this, my 5-year-old with how they are, they want more information, will have lots of questions. Others, I may just need to give them a summary and that will work best, and then wait for them to ask questions.
And then when it comes to, for the patients, how do you help with making sure that they can still maintain a sense of identity and purpose during cancer treatment? Because a lot of times the psychology is that, my life is over. What purpose do I have now? It's the end of the road. So how do you help maintaining with that sense with patients?
Mm-hmm. So a key thing is, them learning to continue to live and thrive even with cancer. Sometimes that takes lots of creativity to explore what is most meaningful to them, what brings them a great sense of purpose, and then how can we creatively design that or change it based on how they're feeling. So oftentimes that means having to pace activities or take breaks, or it's finding ways that you can still connect with meaningful things or loved ones in spite of cancer.
Yeah, well, that's really important. Yep. And so why is psychological support still underutilized in cancer care? Like how can communities help? How do we raise awareness about it?
So we've done a lot of great work on improving mental health stigma, but there's still lots of room for continued improvement. I think the biggest thing is understanding that if we use language in this dualistic model, like there's mental and physical health and they're two separate categories.
Yeah.
When in reality, right, our brain and body is all connected. So we have to be treating your whole human experience. That has to include managing distress, noticing what helps you to connect to sources of meaning or manage any symptoms, and knowing that then these are going to make a positive impact on your cancer outcomes.
So you had mentioned like the language piece, but what other barriers do you see that people face when they're seeking mental health support during their cancer? Is it more like socioeconomic? Is it just more psychological?
So some is stigma, maybe not being willing to, or some individuals, their definitions of strength might not include addressing any distress. And then absolutely cost. So if there's any insurance barriers, transportation barriers, fortunately telehealth is huge now, so you can get connected to a therapist from the comfort of your home. And then I think it's having access to the right person.
Sure.
When it comes to a psychologist, a psychotherapist, it really is about a match, a key fit. So sometimes someone may be connected to a therapist and it's just not a good fit. And so they'll stop there.
Sure.
I would always encourage people, if it's not a good fit, that's okay, that happens, and to keep looking for resources. I think the other thing is if someone is seeking cancer care at an institution that doesn't have a psychologist or a specialist, that can be hard. So trying to get connected to someone who can actually cater to specifics of the cancer experience.
Of course. And I'm sure a lot of it also has to do with the individuals themselves, especially if they're of the mindset like, they want to save face in front of their family. They don't want to show any signs of weakness into the family. So I'm sure that also has a big impact in that decision making as well. So how can we create more emotionally supportive environments for patients in hospitals or in the clinic setting?
I think asking questions is really key. A lot of our medicine can feel very didactic, right? We're teaching, we're telling, and we miss a big thing, which is really to be asking questions. Across a lot of cancer centers now, we have made assessment for distress screening to be the standard so that patients are used to it, and it's a key way to get information to connect them to resources.
Yeah, no, like you mentioned, I know in the clinic setting, when it's a doctor-patient relationship, after that patient leaves the clinic, we don't know what's going on with them, and we assume or we hope that they have those resources available, or they have the family support and the social support. But it's really important to have that network of the team. So what coping techniques or tools do you recommend for dealing with like fear or the pain or just uncertainty?
One of the biggest things is what we refer to as mindfulness, or attention to the present moment. So the human brain has this very unique ability. We can think about the past, we can plan, worry, think about the future. This is actually a great thing that we can do this. The downside is our thoughts can be in a million places, which can be very overwhelming. Mindfulness is the process of noticing that and redirecting our attention back to our body with things like deep breathing, guided meditation. If you're connected to your breath or your 5 senses, that's going to help ground us. It doesn't wave a magic wand and get rid of fear and worry, but it helps it feel more manageable.
So in your practice, do you go over those techniques with patients too, as when it comes to deep breathing or other mindful? Do you mind going into detail about those?
Yeah, so oftentimes mindfulness can feel like a very abstract concept, and so it works better experientially. So I typically describe kind of an overview of what that is, and then I usually guide them through some kind of breathing exercise or a body scan, and then usually recommend, oftentimes there's free apps or audio recordings that guide individuals through this so that they get a sense of how it works, and then even sometimes they can do it self-guided.
Very nice, very nice. And then in your practice, like, what role do you think spirituality plays in the diagnosis and through this whole recovery process?
First and foremost, that's very unique to the individual. So if spirituality is important to you, if you have a faith community, if prayer is important, continuing those practices throughout cancer treatment. There's been a whole host of research that has shown that prayer or connection to your spirituality can have a positive impact on your well-being, but also going through and managing the side effects in cancer itself.
Yeah, and just going on that too, like how strong of a role do you think faith has on that attitude towards cancer?
I think if faith is guiding someone to align with accepting what is going on while still providing lots of support and hope, then it's really, really beneficial.
You know, and I'm sure in your practice and just in medicine in general too, like a person's faith can get tested or challenged whenever they get this devastating diagnosis. So do any of them feel like they're being punished by God or like a higher entity? And when those kind of conversations come up, how do you navigate those conversations without going against the patient's beliefs?
Yeah, I think asking good questions and reflecting is really helpful. I think exploring and noticing, right, our brain can be very judgmental. I think a perspective taking exercise can often be helpful in asking an individual if they feel that way. So if this was your spouse, your child, your loved one, and that thought came to them, you're being punished for this disease, what would you tell that loved one? Most people wouldn't say, yes, that's what I would believe. So then thinking about how can we broaden that out to use faith in a more positive or hopeful way throughout their coping.
And what are your biggest frustrations or hurdles in your field?
I think sometimes it's getting access to care. So we have specialists at St. Luke's Cancer Institute. That's not across every cancer center. So sometimes having really long wait lists. So optimally, it would be wonderful if patients would get in very quickly after their diagnosis, or sometimes people really want to see us to process prior to surgery or a certain time point. And I wish there were more of us and more hours in the day so that we could get them in a timely manner. So I think access can be a huge problem.
And like any challenging cases that you can recall in your practice, or what was the most challenging patient or situation that you can recall?
That's a good question.
And I'm sorry, I'm putting you on the spot
No,
there.
that's okay. I think oftentimes when we're seeing a lot of young patients.
Oh, yeah.
So younger and younger, and I think young patients with children can be very difficult navigating how are they going to talk to them about that. Hopefully they have a huge support system that helps them with transportation, but also caring for their children. I think when individuals don't have access to those things, it's really challenging because my work with them, right? We can work on coping strategies. We can help them navigate the mental challenges. But if they don't have a support system, they don't have financial resources, it feels like you're just battling upstream.
Yeah, and a lot of times patients and their families don't know what they don't know unless you talk about it and have that conversation. They'll be like, "Oh, really? This exists?" You're like, "Yeah, it does." And I'm surprised nobody told you. So that can be really challenging. Yeah.
I think another big challenge these days, but has been for a while, is that oftentimes anxiety can be fed by the internet.
Oh yes. Yeah.
So I always encourage patients to, if you have questions about your diagnosis, your treatment, your prognosis, the best source of information is going to be your medical oncologist and your team. Because the internet is missing a very key piece. The patient is not on the internet. Their medical file is not in there. And so I think really saving those questions for our medical team. We have the internet at our fingertips, which is wonderful. It's a wealth of knowledge. It's also a wealth of misinformation.
Exactly. Now you had mentioned the medical team. Can you tell me like who is on the team when it comes to when somebody is diagnosed with cancer and then they see the oncologist? Who else is part of the team?
So at St. Luke's Cancer Institute, they'll have their medical oncologist. Depending on the type of cancer, they might also be connected with a surgeon. They're going to have their nurse clinician who's kind of helping navigate or a nurse navigator who will help navigate a lot of the questions and future appointments. We have an oncology specific dietitian. We also have social workers that are helping with connecting them to resources, transportation, finances. We also have oncology-specific trained physical therapists, occupational therapists for certain types of cancer, especially breast cancer. We have lymphedema therapists. And then sometimes we even have to refer out to other specialties depending on how the cancer is impacting their body.
I know for women, especially like when it comes to post-mastectomy and then also in general, just when they're losing their hair, how traumatic is it for them?
So typically there's some level of distress, but I would say that varies widely on how distressing or how someone would even deem traumatic. So for women especially, that can be a big source of the female identity to have hair. So oftentimes the biggest thing is I always normalize the experience and making sure that they're allowing themselves to process emotions. Sometimes people feel like they have to save face or pretend like it doesn't bother them. Family members, not just with hair loss, but a lot of things, oftentimes say things like, "It's fine, don't worry about it," which they're intending to be helpful, but can feel very invalidating.
Yes, that's true.
So I think I always tell individuals that they have to find what makes them feel most comfortable. For some, that is wearing, scarves or hats. For others, they feel most comfortable in wigs. There is no prescribed way to deal with that. It's really what feels most comfortable to them.
Okay. And you have brought some resources with you. Would you mind going into some detail about
Absolutely. I mentioned before Gildas Club Kansas City. This is a nonprofit organization. So it's kind of near the St. Luke's Cancer Plaza Hospital is their physical location, but they also serve other local communities. They have virtual programming, so they have education classes. They have cancer support groups. They have a program specific to caregivers, to teenagers and kids. And that, whenever you post this, you can include their website that lists how to get connected and how to sign up.
Great.
The other is called Turning Point. This is affiliated with the University of Kansas Health System. They serve anyone with a chronic illness, but they also have some cancer-specific programming. Again, exercise classes, art classes, educational courses, and support groups as well.
That's wonderful. Yeah, that's really much needed.
And then Cancer Action is a wonderful local organization that offers a lot of free services that will help patients with getting nutritional supplements, like a case of Boost if they're having a difficulty eating. They have some gas cards to help with transportation. They also have some post-mastectomy resources. They have wigs and scarves. They have 2 different offices, one in Kansas and one in Missouri. And contacting those to find out what's the best office to go to is a good way to connect to them.
Excellent.
It would be remiss to talk about mental health without mentioning, some are familiar with, we think of the suicide hotline. It's actually the crisis hotline. You do not have to be thinking about suicide to call. It's completely free. It's available at all hours. And all you have to do is call or text 988.
Yeah. Just so like if you're just having a bad day or just really having really depressing thoughts or having a lot of anxiety, then
yeah, if you can't, it's in the middle of the night, so it's not a good time to wake up a loved one or call your psychologist. You may not need the emergency room. You may just need to talk through what's going. Sometimes just thoughts in our head can get really muddled and hard to analyze. Saying them out loud or even journaling them, writing them down can sometimes give us some release and not as much worry.
Yeah, no, that's excellent. Thank you so much for bringing that up.
There's also a list of there's specific areas that will offer that you can go in and try on wigs. There's others that also include post-mastectomy bras or prosthetics. Sometimes that you can ask your medical oncologist for a prescription to see if some of that or all of it can be covered. And then there's different organizations in the area. It's best to find what is going to be closest to your home.
Oh, insurance will cover some of that?
Yep.
Oh, okay.
It depends on the insurance, but it's always good it usually requires, a lot of those will require a prescription from your oncologist that then you send to your insurance company to find out how much they will cover. And then depending on where you're receiving your cancer care, if they have social workers, they're really great to connect with because they'll know of some any resources that'll help with transportation to and from appointments or any grants or financial resources. Sometimes those are cancer type dependent, so they're able to navigate you through that process.
Oh, wow. Well, thank you so much for bringing that up. So any final parting thoughts? Anything that I did not ask you that you want to talk about right now?
No, I think just to highlight that whole person care mentality is really, really helpful. At St. Luke's Cancer Institute, we have the Kuntz Center for Advanced Breast Cancer. This is a multidisciplinary clinic that focuses specifically on anyone with a stage 4 breast cancer diagnosis, also called advanced or metastatic breast cancer. For any new patient at our clinic, they are set up with an appointment with an entire team. So on the same day, they see their medical oncologist, they see myself, a psychologist, a dietitian, a physical therapist, and the social worker. We all meet with the patient, sometimes they include their loved ones, and then we meet as a team to talk about any recommendations to help with that treatment plan. Then the medical oncologist meets with them and develops an entire whole person care plan so that they understand this is what your treatment looks like and these are all of the resources that you have access to.
That's amazing. I mean, having that team-based approach, that's very, very important because a lot of times patients can just feel lost if they just talk to their doctor and the doctor doesn't necessarily have the time to sit down and talk to them about the whole gamut of issues that could be facing. So that's really amazing.
And even sometimes patients at health systems in the Kansas City area will get a binder or a notebook with tons of resources in a time where they're in shock and they're scared and they might not hear all of that. So our hope is that we're introducing those services in a very meaningful way. They may not need them then, but then it won't be a surprise or they'll be able to know those are available across the cancer trajectory.
Wow. Well, Thank you so much.
Of course.
I really appreciate your time.
Of course.
And thank you so much for what you're doing. It's very, very meaningful, and I'm sure the patients really appreciate it. And thank you so much for your time today.
Absolutely. Thank you for having me.
Yeah. And the resources that Dr. Harry brought up regarding financial assistance with treatment, hospital bills, medication assistance, counseling, groups, post-mastectomy resource list, wigs, these will all be provided, and that information will be shown to you here or as a link.